my supercharged people. This is Dr. Shivam, and this session is going to be very important for you because in short time we will be discussing some important topics related to your NeetPg examination, and along with that we will discuss simultaneously all the probable MCQs whichever is possible with them. So starting with the atrophic rhinitis, which is a chronic rhinitis associated with atrophy of nasal mucosa, its gland and nerves and vessel. So usually it is seen bilateral in nature, which is IgE mediated immunological response, and different types of atrophic rhinitis you can classify them into primary atrophic rhinitis and secondary atrophic rhinitis. So what do you mean by primary? The cause basically is idiopathic, but the secondary atrophic rhinitis is a result of some destructive granulomatous conditions of nose, example leprosy, rhinoscleroma, syphilis, SLE, or it can also result due to or secondary to excessive tissue destruction following surgery or trauma. So these were the features of primary and secondary atrophic rhinitis. Now it is basically a multifactorial condition, and the different reasons or the different etiology can be defined under hereditary, autoimmune, Klebsiella infection, that is Klebsiella oozeni, or Staphylococcus or Streptococci or Coccobacillus oozeni. So that is why it is also called as oozina. So atrophic rhinitis, you must remember that it is caused by Klebsiella oozeni. Hormonal control. Why hormonal control? Because estrogen deficiency is one of the cause. Although they are not seen in postmenopausal women, but in young females having estrogen deficiency. So typically seen at puberty in those females who are estrogen deficient. Also some nutritional deficiency can be its one of the etiology, that like vitamin A, D and iron. So there are several causes. So multifactorial condition resulting in atrophy of nasal mucosa, its nerve fibers, vascular structure. And what happens? So everything in the nose atrophies, and this leads to a condition called roomy nasal cavity. That means the nasal cavity now becomes very big, and what means is accompanied by destruction of mucous gland. And when these mucus or the mucosa of the nasal cavity get exposed to dry air, it results in drying of the nasal cavity and formation of crust. So basically you see a lot of crust formation in atrophic rhinitis. So it leads to crust formation and foul smelly discharge due to further infection in this crust and this that is the secondary infection leads to the foul smelly discharge. But what is the merciful anosmia which is seen here is due to the patient himself is not able to smell the foul smell which is being discharged from his nose. So he is brought by his family or friends to the doctor because the patient has anosmia because of atrophy of nerves, and whatever mucosa and nerves is left is covered by crust. So that's why it is called merciful anosmia. That is, the patient himself is not able to smell the foul thing which is there in his or her nose. And most common symptom is by strange which is observed is nasal obstruction. So there are two contrasting conditions, that is the patient has a roomy nasal cavity, that is the nasal cavity becomes big, but the patient has a false sense of nasal obstruction. So because he is not getting any sensation due to degeneration of the nerve of sensation of air passing through his nose, so it appears that there is nasal obstruction. So it is a false sensation which is observed by the patient. And if you want to see the management, so principle of medical management is removal of crust and treatment of infection along with prevention of further formation of crust. So how this is possible? What you can do is you can give the patient some alkaline nasal douche which will contain this sodium chloride, sodium bicarbonate and sodium biborate in the ratio of 1:1:2. So it is dissolved in around 280 ml of distilled water, and it is used for washing the nose to remove the nasal crust. So this is one of the modality. It is treated under different modalities, both surgical and medicinal. In medicinal, you can also try 25% glucose in glycerin spray. So what it does is, glycerin is a hygroscopic agent and glucose inhibits the proteolytic organism. So 25% glucose. So in MCQ, if they mention this, get the diagnosis of atrophic rhinitis. So 25% glucose and glycerin, so they come in the form of spray. So glycerin spray. Okay, so glucose on fermentation produces lactic acid and an acidic pH that inhibits the proteolytic organism, and glycerin acts as lubricant and hygroscopic agent which absorbs the water from the atmosphere and moistens the mucosa. So it prevents the formation of crust. So these are also used, and there is one solution called chemicetine solution. So what is this chemicetine solution? It is basically containing COPD. So what do I mean by COPD? C for chloramphenicol, O for estradiol, P for propylene glycol, and D for vitamin D2. So C for chloramphenicol, O for estradiol, P for propylene glycol, and vitamin D2. So this chemicetine solution is also being used, and sometimes submucosal placental extract and estradiol sprays are also used. Potassium iodide is also one of the solution which is being used for increasing the nasal secretion. So Ki is also one of the medicinal therapy. Now if medicinal therapy don't work, what we can do? So we can move to another modality, that is the surgical. So in case of surgical, what we do is we obliterate the nasal cavity. So it is called Young's operation. So it is one of the important and separate MCQ. You all must be knowing Young's operation and modified Young's operation. So in Young's operation, you raise a mucosal flap on both the lateral wall and the medial wall, and then you suture them in midline so that you close the nostril completely. And when the nostril is opened after, so this is separate one, after 6 months to 1 year, you observe that the nasal mucosa is now regenerated. And as this Young's operation is quite radical, patient may not be habituated or may complain difficulty. So in modified Young's, what you do is you partially close the nose. That means you leave a 3 millimeter opening in the center of two flaps so that some air passes, and it is called modified Young's operation. So both are done for atrophic rhinitis. We will see they have been asked in exam, and sometimes to prevent or to cure the roomy nasal cavity, you inject the Teflon on the lateral wall, and the surgery is known as Lawton-Schlager's operation. So it aims at narrowing the nasal cavity to decrease the drying effect and crusting. Now there is one similar condition I want to mention here along with it is rhinitis sicca. So what is this rhinitis sicca? So it is the findings of the anterior rhinoscopy resembles the atrophic rhinitis, but the clinical findings resembles the atrophic rhinitis in only anterior 1/3 of the nose. Why I am saying this? Because rhinitis sicca happens in patients who are exposed to hot, dry climate. like bakers, like ironsmiths. So in question, if you get like patient having or working in bakery or ironsmith and complaining of symptoms similar to atrophic rhinitis, you will fetch a diagnosis of rhinitis sicca. So here, basically here also crust happens, but only in anterior one third. There is another term called rhinitis caseosa. So everyone knows atrophic rhinitis, everyone knows allergic rhinitis, but what is rhinitis caseosa? And you know that it is also known as nasal cholesteatoma. So by now you have been studying about ear cholesteatoma, but this rhinitis caseosa is called nasal cholesteatoma. So strange to know, na? So this is basically collection of cheesy material in the nose following chronic sinusitis or any obstruction. So what you observe is you get cheesy material inside the nose. That is why it is called rhinitis caseosa, and it is termed as cholesteatoma of nose just because of its appearance like cholesteatoma of ear. So it is basically unilateral condition, more commonly seen in male, and management is just scooping out the discharge and treating the associated cause. So rhinitis caseosa and sicca forms an important thing for you to be asked in your NeetPg examination. Now we'll discuss the MCQs right now related to the atrophic rhinitis, because I want you all to be perfect in whatever you are reading, because you have no time now. Time is short for you and you should be very thorough with your revisions, because whatever you are doing, you should be confident and perfect in them. So we'll see. Okay. So if I maximize it and you go to the question number 7, that is, which of the following organism is associated in causing atrophic rhinitis? So now you can easily tell the answer, and the answer here is Klebsiella oozini. So you got this answer right. Now oozini is also known as, so oozini is also known as, you know the answer is atrophic rhinitis. Now all are implicated in etiology of atrophic rhinitis except, so if you read the option, surgical excessive tissue destruction, yes, it is one of the cause. Granulomatous condition already discussed. DNS, no. Strong hereditary factor, yes. So DNS is not implicated in etiology of atrophic rhinitis, and what happens in DNS is you see physiological hypertrophy of turbinates opposite to the side of DNS. So we get a contrast, that is, if a patient is having DNS or if an atrophic rhinitis patient has a DNS, so it is good for you because there will be a physiological hypertrophy of the turbinates on the opposite side, and it will help him or her to prevent his roomy nasal cavity which was causing. And what we were doing in Young's operation is only decreasing the nasal cavity size. So if the patient already has a DNS, he will have a naturally smaller nasal cavity due to hypertrophy turbinate in that person due to DNS. So I think you got the answer, that is DNS is not the etiological factor. Now regarding another question is regarding atrophic rhinitis, which is false. So if you see this question is good. So common in females, yes, right, they are asking false. Can occur secondary to syphilis, yes. Anosmia is present, yes. Merciful anosmia. Seen in 60 to 50 years of life, no. These are seen particularly near the puberty in females having less estrogen. So it is not seen in 50 to 60 years of life. Now all are true about oozini except common in female, yes. It is usually unilateral. Nasal cavity is filled with crust. and can be associated with atrophic pharyngitis and laryngitis. So the option here is it is usually unilateral. No, it is a bilateral condition. So all are true about atrophic rhinitis except more common in female. No, it is more common in males. No, it is more common in female. Crust are seen. Anosmia is noticed. Young's operation is useful. Yes, all other are right. Now most common so most common cause of obstruction in atrophic rhinitis is excessive formation of crust, polyp, synecdoche, hypertrophy of turbinates. Now you all tell me the answer. Yes, so it is excessive formation of crust. Alkaline douche solution of nose does not contain. So see how many important questions are getting solved, and they are asking so many questions from this topic. So alkaline nasal douche does not contain. So you have to read the question properly, because in hurry you miss this not, the except, and this makes your question wrong even if you know them. So the most important thing in exam is to control your nerves, to control your adrenaline rush, and to see these not, to see these excepts, and every other single point which the examiner wants you to notice. So if you see NaCl is there, sodium biborate is there, sodium and this bicarbonate is there. So what is not there? So glucose was not there. Young operation is done for atrophic rhinitis. So it is becoming easy for you now to answer this question. Now one more question is, feature of atrophic rhinitis include. So watery nose, no. Anosmia, yes. Swelling of turbinates, no. Swelling over the dorsum of nose, no. So you see, you have been able to answer these questions so easily, and now in a similar way we will discuss the allergic rhinitis as well as the other conditions, whichever is important for you. So we'll move to the other part, that is